Hi guys, welcome to my channel, spreading my love and awareness. If it's your first time to be here, what's up? Don't forget to click the red button. Then, warning. This video is for females. Females, if you're a female, stay because you need to hear this. But if you're a male, don't go away, okay? Because, you might have a girlfriend, a wife, you know how it is. Just stay and listen to what I have for you guys today. Now that your piercing has healed, you are so ready to explore the world of jewelry. I got your back. Start with bodycandy.com. Use my promo code Michelle Mutangadura 25 so that you can get 25% off of any jewelry of your choice. Simply click the link in my description and start exploring the world of jewelry. There is a variety of designs and sizes of jewelry pieces you can definitely choose from. Happy body modification. Bye. Okay, so today we're talking about premenstrual dysphoric or dysphoric disorder. So what is premenstrual dysphoric disorder? I'm going to be calling it PMDD just to make my life a whole lot easier. So premenstrual PDD PMDD. Okay, so PMDD is a type of depression. It's actually a type of a mood disorder where you feel depressed and all of that stuff just before you start your periods. That's what premenstrual disorder is. You'll get to understand more of what it is from the symptoms and what you can do and all of that stuff. So right now, I'm going to move on to the causes of premenstrual disorder. So first of all, the causes aren't clear yet. Just like most of mood disorders, for some reason, there's no specific cause. It just so happens. And that's when we start to talk about who's at risk of developing PMDD. So you're actually more at risk of developing PMDD if you have postpartum depression, or if your family has a history of postpartum depression, as well as mood disorders, like any other mood disorder. So if you haven't watched my other mood disorder videos, I will definitely make a playlist and put it up there so that you know what mood disorders are. I feel like this is actually my last mood disorder video. I've had maybe 5 or 4 videos talking about mood disorders. So if you haven't been watching those, I'll put them right there. And also do take note that the hormonal changes that women have that take place in the menstruation cycle do actually play a role in putting us at risk of PMDD. So I'm move on to the symptoms. I would have asked you people to put 10 fingers up, but guys, the symptoms are a lot, and I have a lot to explain about the symptoms because I'm afraid that with these symptoms during your menstruation or whatever, most of you face them. So I don't want you to think that because I've said it, you have PMDD, but I'll explain how you'll know if you have it or not when I start talking about the symptoms, which is right now. So take note that these symptoms are present a week before your period starts, and then they last a few days into your periods. So I know that during the menstrual cycle, most of us women have a lot of things going on during menstruation. So just know that if you have PMDD, it starts a week before you even get into your periods, and then it just lasts for maybe 2 or 3 days when your periods start. Okay, so that's what I really want you to take note of. I don't want anybody to think that they have PMDD, because most of these you might realize that most women face these during menstruation. So this is a week before menstruation and like a little bit inside menstruation. So I have just about 22 symptoms that you should take note of. If you could take like a book or just somewhere where you can like note down or like put like a tally number thing, like if you can tally these so that you can keep track of how many you are feeling like you have and all of that. Then before I do you know what, I'm gonna just start because I'll explain what I just wanted to explain now when we start to talk about the diagnosis. But do note down if you're feeling any of these symptoms. Women, it's very important. I know so many people that may have felt these or, okay, I don't know so many people, but just, pay very much attention, please. Thank you. So if you're suffering from PMDD, you face the following symptoms. First of all, you have, not first of all, it's not in any order. So you feel severe fatigue, mood changes including irritability, nervousness, depression, and anxiety. You are crying and very emotionally sensitive. Yeah, so many tears flying around everywhere. And you have difficulty concentrating. You have heart palpitations. You are paranoid and you have issues with self-image. You have coordination difficulties. You're forgetful. You feel bloated and have an increase in appetite. So I just want to explain what heart palpitations are in case anyone does not really know what those are. So this is when you have irregular like heartbeats, It's more like, how like everybody knows your heart like beats in a certain tune, but if it becomes irregular and a bit like maybe too strong and it's irregular, that's like heart palpitations. For those that don't know what those are, moving on, you have painful menses. Like when your menstruation starts, they will be very painful. You will suffer from headaches. You'll suffer from backaches. You'll have muscle spasms, numbness, or tingling in the FYI, I do not know how I don't know how I was about to pronounce that word, guys. I wanted to say muscle spasms, numbness, or tingling in the extremities. You will have hot flashes. So hot flashes are basically temperature related. So one time your body is like keeping a constant temperature, and then there's this flash of heat and you suddenly feel very hot. So that's what hot flashes are. You'll have decreased libido. You'll have easy bruising. Like if you get hurt, you easily bruise. You'll feel dizziness. You might or will faint. You'll be feeling sleepless. You'll have heightened sensitivity, like I had already mentioned earlier. And your vision changes and your eye, you'll have a change in vision, and you might have like a lot of eye complaints. And you complain a lot about your respiration. You might start to have allergies and infections that are affecting your respiratory system. So now, moving on to how it's diagnosed. This is where you really need to pay more attention. I don't want you guys to freak out and think you have it, so you need to pay attention to this part. Then also, after I tell you how it's diagnosed, don't rush to tell yourself that, oh my god, I have it. If you suspect that you do have it, then I'm encouraging you to go and seek a health professional. you get tested physically, and then you get like a mental health check and everything. So just if you suspect you do have it, that's my advice. Moving on. So according to the DSM, which is the diagnostics, okay, you know what? It's just a manual, guys, where mental health professionals are able to take whether or not you are facing a certain, it just helps people diagnose whatever you're going through. I don't just look the word up. I always struggle to say it. Anyway, so the symptoms should be present for a minimum of 2 consecutive menstrual cycles before making a diagnosis. And then they may leap into a few days when your menstruation starts. So you have to face these symptoms for 2 consecutive menstrual cycles, okay? Like one after the other, not like once, then like 5 months later you're feeling it again. No, consecutively, twice, for at least 2 times. Yeah. Then also you should face at least 5 symptoms that I'd mentioned before, including one of the following that I'm gonna mention right now. Okay, so 5 of the ones I've mentioned before, including one of the ones I'm going to talk about now. So anxiety or tension, sadness or hopelessness, mood changes or increased sensitivity, feelings of anger or irritability. So you have to also at least face one of the ones I just mentioned, including 4 or 5 of the ones I mentioned before, for you to be diagnosed with PMDD. Yeah. So moving on to the treatments. So we have medication. So the medication for PMDD will affect your ovulation. It will also have an impact on your central nervous system. Then other options could be supplements, but I'm not gonna talk more about supplements because it hasn't, people haven't studied the after effects of taking supplements on PMDD. So I will not talk about that or advise it because I am not familiar with the area. But you should go and check it out if you feel like supplements might be a great, might work better with your body and everything. Then yoga and acupuncture. This is like my favorite part of treatments. I am a sucker for self-treatment and stuff. Your yoga, your acupuncture, guys, guided imagery, perfect. Diet and exercise. So with diet, you will have to change a couple of things. You'll have to decrease your sugar intake. You have to decrease your salt intake. You will have to avoid drinking alcohol, caffeine as well. Avoid that. Then you have to increase protein and your intake of complex carbohydrates. Okay, so I hope you enjoyed this video, and if you've made it till the end, I'm grateful, I'm thankful. Just don't forget to like, comment, subscribe, and get consulted if you feel like this video, if you feel like the symptoms do apply to you, do get checked. And bye guys, I'll see you next time.